medical student's guide to the staff of Abertawe Bro Morgannwg University Health Board. Beginning your first clinical placement can be an overwhelming experience, not only in terms of the medical knowledge that will be expected of you, but also the workings of the hospital itself and the various roles of the staff that work there. This short video aims to prepare you for your first clinical placement by introducing you to some of the professionals you will encounter in the hospital and give you a brief idea of their roles, along with some helpful tips to make your time on placement go smoothly. By the end of this video, you should have a better idea of who is who, which will help you feel more relaxed about your first clinical placement and allow you to confidently interact with others in the hospital. Firstly, let's talk about you, the medical student. It is important that all staff and patients in the hospital can easily identify you as a medical student and not mistake you for a qualified clinician, so it is important to wear your ID card and lanyard at all times. In line with the NICE guidelines for infection prevention and control, all ABMU hospitals follow a bare below the elbow policy. This means that all long sleeves must be rolled up to the elbow, and no wristwatches, nail polish or stone rings should be worn when delivering direct patient care. Another way to distinguish medical students from junior doctors is the presence or absence of a stethoscope. So for this reason, it is requested that medical students do not wear the stethoscope around their neck. You may instead tuck it into your belt loop or carry it in a small bag. On placement, junior doctors may look very similar to you as medical students, but as we have already learned, they wear their stethoscope around their neck and they won't have a red lanyard on. Of all the doctors in the hospital, junior doctors, also known as FY1s or junior house officers, have the closest knowledge set to yours, but other doctors that you will encounter include core trainees, registrars and consultants. All are a great source of clinical knowledge, as well as general information about the hospital. Healthcare assistants, or HCAs, are recognisable by their green uniform. Most commonly, they work alongside nurses in washing and dressing patients, feeding and toileting, bed making and monitoring patients by regularly doing so-called observations, or OBS. If you want to know where anything is kept on the ward, the HCA is a good first person to ask. Note the orange speech bubble on the right breast here. This indicates that this healthcare professional is a Welsh speaker. You will see quite a few of these embroidered symbols on staff uniforms around the hospital. Student nurses wear a purple uniform. You may still see some of them wearing a white tunic with yellow lapels. These are the old student nurse uniforms and are being phased out. Student nurses work shifts on the wards, just as qualified nurses do, so they are a valuable source of information both about patients on the ward and where important supplies such as ventlons, bedding and neuro exam equipment are kept. Occupational therapists, or OTs, can be identified by their white tunic with a green trim and green trousers. OTs carry out patient assessments in the context of disability, ageing, accident or ill health, with the aim of promoting safe, independent function. Physio and occupational therapist expertise is often required in mobilising frail or disabled patients, especially if specialist equipment such as hoists are needed. They are frequently involved in complex cases involving the discharge from hospital of elderly patients. Physiotherapists, or physios, wear a white polo shirt and navy trousers. Their assistants wear pale blue t-shirts. Physio's role in patient rehabilitation is not limited to musculoskeletal injuries. They frequently guide patients through pulmonary rehabilitation programs, so you may see them with a stethoscope around their neck. They work in close cooperation with occupational therapists to ensure that patients can carry out activities of daily living. Clinical nurse specialists usually wear a royal blue uniform, although some wear their own clothes. Clinical nurse specialists are an important part of the multidisciplinary team, MDT for short, and provide expert advice related to specific conditions or treatment pathways. They focus on improving patient care and developing services. They often handle intra-hospital referrals. So if, for example, a patient on the cardiology ward needs their asthma medication reviewing, they may be seen by the specialist respiratory nurse. Many run their own outpatient clinics. You may also see them in multidisciplinary team meetings. Ward sisters, known as charge nurses if they are male, wear a navy blue uniform. The role of ward sisters and charge nurses can be both managerial and clinical. They are in overall charge of the running of the ward. They manage both the budget and the use of resources, and also delegate the work of staff nurses. They are in effect the line managers for a team of nursing and support staff. They combine a managerial role with their clinical work, so you may frequently see them in an office, as well as being involved in direct patient care and carrying out clinical assessments. Staff nurses on adult wards wear a light blue uniform. They work shifts on the wards and have separate patient nursing notes and handovers of information at each shift changeover. During this time, all members of the team are updated on the progress of each patient on the ward. Some staff nurses are trained in venipuncture and cannulation. Other forms of nursing you will encounter are mental health, intensive care, theatre and recovery nurses. You will experience for yourself the role of a staff nurse in your nursing week during your first clinical placement. Other allied health professionals that you may see in the hospital are not included in this video because either they are based in their own section of the hospital rather than on the wards, or their roles are more easily identifiable. Examples of such healthcare professionals
include radiographers, speech and language therapists, and dietitians.